So today I am joined by Brooke. Today we're going to be doing the floor clock exercise, which is the final exercise in our progression and the most advanced one. So for this exercise, you are going to have a stance leg and the other leg is going to have a foot on the slider like you do. So this exercise is great to help the patient with their balance as well as neuromuscular control. Additionally, this exercise is a great bridge between rehab and getting the patient back into daily life activities like walking, running, and in circumstances of an athlete, motions like change of direction or pivoting. So you are going to shift most of your weight onto that stance leg and have a slight bend in the knee. From there, you're going to extend that slider forward, to the right, behind you, and then to your right. Perfect, just in a clock formation like that.
The primary joint movements of this exercise include hip flexion and extension within the sagittal plane, hip abduction and adduction in the frontal plane, finally hip external and internal rotation when the foot moves outward and inward in the clock motion. The prime movers for hip flexion move left on the LTR curve during concentric contraction, and those are the iliopsoas and the rectus femoris, while the antagonists contract eccentrically moving right on the LTR curve, which include the gluteus maximus and the hamstrings. Now, during hip extension, the roles are reversed where the gluteus maximus and hamstrings are the prime movers moving left on the LTR curve through concentric contractions, and the iliopsoas and rectus femoris are the antagonists contracting eccentrically moving right on the LTR curve. The gluteus medius and minimus are the prime movers during hip abduction, which contract concentrically, moving left on the LTR curve, while the adductor group is the antagonists, which are contracting eccentrically, moving right on the LTR curve. Same as hip extension, the roles are reversed for hip adduction. The prime movers are the adductor group, which move left on the LTR curve through concentric contractions, and the gluteus medius and minimus are the antagonists moving right on the LTR curve through eccentric contractions. Within the trunk and pelvis, the rectus abdominis, transverse abdominis, and the obliques act as stabilizers, while the quads and hamstrings in the knee contract isometrically, also stabilizing the patient. Throughout all the hip movements, the range of motion for flexion ranges from 0 to 120 degrees, extension from 0 to 30 degrees, abduction 0 to 45 degrees, and finally adduction 0 to 30 degrees.
So next I'm going to go over some common mistakes that are made on this exercise. The first one is the patient putting too much weight into the sliding foot so that it becomes more of a lunge, which is what we're trying to avoid. So for this, ideally we want 80 to 90% of the body weight on the stance leg. That slight bend of the knee will also help engage those prime movers and then take pressure away from the joint itself. The next common mistake that's made is knee valgus during the exercise, so that knee falling inward. So for this one, a lot of times it's due to a weakened gluteus medius. So we really want the patient to activate their glute muscles while doing the exercise. And then our final common mistake is excessive trunk lean while doing the exercise, as they're kind of compensating. So for this one, you just really want to engage those core muscles and keep a straight spine on the exercise. So now I'm going to have Brooke do a few more for us, but before she begins, I'm going to give a few helpful tips. So if you want to go ahead and get in that position, have a slight bend in that stance knee, and try and engage those glute muscles as well as those core muscles. Sometimes for patients, it helps to take a deep breath in, tense the stomach, and hold this during the exercise. So if you want to go ahead with the clocks. Perfect. In order to progress this exercise with time, of course, patients will get more range of motion and more hip flexibility, so that this will then help progress the difficulty. Sometimes you can also add a resistance band for the patient, either around the ankles or the knees, in order to increase the intensity. And these resistant bands will also help with that glute and hip engagement to prevent that knee valgus that we talked about earlier. And then you can go ahead and stop. Thank you so much for doing this. You did great.